The next bill on the calendar for the day is House File 4493. The Chief Clerk will report the bill.
House File number 4493, an act relating to health occupations authorizing pharmacists to initiate, prescribe, administer, and dispense certain drugs for the treatment of opioid use disorder.
I recognize the member from Candy, Ojai, Representative Baker.
Thank you, Mr. Speaker and members. I'm really proud today to bring House File 4493 to your desk in asking you for the support that I believe will literally save a lot of lives, because at the moment, folks are in that really, it's literally the moment. I need help right now. I need it today. They just hit rock bottom. Something happened to them. But putting this bill and giving us more tools with our health providers, the pharmacists, that is likely the one health provider that we all see the most, especially in greater Minnesota, gives them the chance to be able to now prescribe buprenorphine or otherwise known as Suboxone. Those medically assisted treatments have proven time and time and time again that having that access to that right at the time when you need it is life-changing. This bill brings good steps towards that outcome by providing the pharmacists the ability, with some training, optional training, to be able to prescribe those medicines at that moment. This will provide people to get through the worst part of their journey to recovery, which is getting them through withdrawal. If you know anything about this disease of addiction, the withdrawal is the moment and the worst part, and that's what's preventing people from actually getting help. What we have learned in recent years, buprenorphine is the evidence-based, holy smokes, where has this been for a long time? Because we need something like this. Before this, there was methadone, and methadone is highly controlled, hard to get at, daily dosages when you got to get in a car or got to go somewhere to a hospital or a clinic and get this. It is so clunky. This is hard to do. It's still important that it's there, but this setting it up with our pharmaceuticals, our pharmacies in our communities will be a huge step forward. So I ask you that when you know of anybody that is searching for that kind of help, in a couple years ago, you had to make an appointment with your doctor. You had to go see and get a prescription for this if you wanted to do that. If you made it, you might have had to wait a week or two to get to get to your doctor, and that week or two, if you really want to be trying to start recovery, you are so sick that you can't function, and you sometimes can't wait that long, so you start using again. That's the problem with this thing. This is a very good bill. I wish was here earlier. I wish it was here years ago. This is going to be a really good bill. Our pharmacists like it. Our providers like it. It's accessible. This drug is proven. And I would hope that we can move this along forward. So with that, Mr. Speaker, I'll happy to take questions. Thank you.
There are no amendments at the desk. The clerk will give the bill its third reading.
Third reading, House File number 4493.
Third reading. Discussion. I recognize the member from Dakota, Representative Bierman.
Thank you, Mr. Speaker. Thank you, Representative Baker, for bringing this bill forward. As you mentioned, this bill, it is really an important bill. It is a life or death bill for many people who are seeking substance use disorder treatment and don't get it in a timely fashion. So I really appreciate you bringing this forward. And, you know, this issue, substance use disorder treatment, I think a year or two ago, I saw a scale that said 80% of the people needing it don't get it at the moment they need it. And we're making some progress. But this will be a big step forward to have pharmacists able to prescribe and to get that treatment out there when people are needing it and are assessed for it immediately, not waiting for days for prior auth or waiting for prescription through an MD. This can be done at the moment of contact for trained professional pharmacists who know what they're looking at with the patient before them. I also, just want to give a shout out to Rep. Baker with this bill, because when it first came across and I read it for the first time, I had concerns about it. And I wanted to bring an amendment, and I contacted him and I asked him to hear me out, and his first thing that Rep. Baker does is he listens. And he was open to whatever I was suggesting. And he wanted to have follow-up. And he directed me to his associates who helped write the bill. And it really helped alleviate some of my concerns with that. So the bill was very tightly written, and I appreciate the work of Rep. Baker in this area. And also, I commend him for all of his work all these years on the Opioid Epidemic Response Advisory Council. He's a leader of that organization and doing excellent work. And there's such a need for substance use treatment in this state and in this country. And I would ask, if you have time, to go downstairs and look at the organization that has the posters up today for victims of fentanyl overdose. And I would ask you to just walk through there and take a look and read some of those banners and educate yourself more on this issue, because this is far from over. We're in at least our fourth wave of the opioid epidemic, and the reasons are different, but we need to continue to address it. And Rep. Baker, you've always been on the forefront of that. I appreciate your work, and thank you. And members, please vote green.
Further discussion? I recognize a member from Candy, Ojai, Representative Baker.
And thank you, members and Mr. Speaker, and Representative Bierman. Thank you also for serving on the ORAC Council. We are doing amazing work around the whole state of Minnesota, because we were actually leaders in finding dollars from Big Pharma to get them to pay us through registration fees. We were two or 3 years ahead of the national lawsuits and the settlements that were coming. So Minnesota, we have done a lot of really good things around this area. And as you mentioned too, on the east side of the Capitol, on the ground level, there is a number of posters and displays for this entire week for the organization called Friends of, that's the Fentanyl Advocacy Group. And when I'm there this morning, did a short little program, there's my son Dan. And you don't see his picture every day. Well, I guess I do, but when you're around the house and here, you sometimes let the time helps heal. But when you get that moment where here we are, loved ones are downstairs on display that we could not save, because at that time, there was nothing like this at all, to be able to offer my son when he needed it at that moment. We were wound up with getting to the doctor and giving it time, and he had to be completely free of any opioids or anything in his system before you started taking this buprenorphine or methadone. At the time, this was 15 years ago when I lost my son, methadone was sort of the medically used drug at that time to help people block the craving of needing that drug. That was the real trick, but it was highly regulated. Suboxone came around and it made it a lot easier. Still, I go to the doctor, but now in Minnesota, because of a law change in the federal government in 2025, but states have to approve this so that our pharmacists can be FDA approved by this 8-hour training. It's voluntary. They can do this. We got to get this out the door right now, folks. And so I'm really, really proud of my son for telling me, Dad, we can do better in this area. We can help more people. I didn't have these tools then. But today, folks that are ready to be done with this, ready to get out of this cycle of addiction and disease, we're ready to do it today with this bill. This will be one of the best bills, I think, that I've carried to the Minnesota House. So, members, I hope you do light up this board for everybody you know, every loved one that you have heard that is lost, and all the advocates, and every single member that's here, and the people that helped us all pass legislation on this issue. We're going to save people, because they're going to be able to go to the pharmacists that they probably see the most of anyone in our health provider world. They can start doing things as well. So, members, I really appreciate the green vote. Thank you again, Mr. Speaker.
Seeing no further discussion, the clerk will take the roll. The chief clerk will call the name of the member voting remotely.
Momani Hiltsley.
Momani Hiltsley, aye.
Momani Hiltsley votes aye.
The clerk will close the roll. There being 134 yeas and 0 nays, the bill is passed and its title agreed to.